healthy and a clean environment. Distinguished sanitarian doctor, Pastor Samuel Akigbeyin Akimbo Doa. You are highly welcome, sir.
Thank you so much. I greet everybody happy Environmental Health Day. It's nice to have you, sir. You're welcome, sir. Dr. Edwin is okay. Thank you so much for making it a day to us. Thank you so much.
You, President.
Yes, sir. Chancellor Awuniga, the Nigeria chapter chairman of the South African Postgraduate College of Environmental Health. We appreciate you.
Thank you, sir. God bless you, my national president.
Yes, sir. Thank you so much, sir. Sanitarian Comrade Nora Alu, the General Secretary, FN, Sanitarian Pastor Faminola. You're highly welcome. Thank you for the good work you're doing. Our media team, President, thank you so much. I greet you all. I greet you, sir. My lawyer Professor Uncle Amadi, our grandfather. Thank you so much for making it a day with us. Thank you, Professor Lalubi. Thank you so much for making it a memorable event. Thank you so much, Professor.
I believe we are going to have a robust discussion.
Yeah.
Thank you.
Thank you, sir. Thank you, sir. Professor Kemabunta, we appreciate you. Dr. Fowowe, we appreciate you also for making it a date. Thank you, Dr. Isaiah. We respect you so much. Thank you for making it up. Thank you so much, Dr. Bala Geso. Thank you so much for making it. Thank you. We appreciate you. All our panelists and all our distinguished speakers. Really appreciate you all. Over to you again. We are still at our meeting and opening ceremony.
All right. Thank you, my highly distinguished sanitarian, doctor, pastor, the kingmakers. Thank you for that, adding your voice to this introductory aspect. So shortly we will start. We are still admitting more members so that we can have a robust participation. Hello. Currently, we are about 56 members. So we are moving forward. Thank you. Sanitarian Samson, please, over to you.
Dr. Bashir Balajeso, sorry, your profile was being worked upon, and very soon you'll see it online. We have published all necessary, but the initial photograph was not good, and we have to go and look for another one for you. So your profile is done soon. I want to make a plea before my opening address to Professor Awal Vida, speaker for the second lecture. For the fact that Dr. Baba Yakubu It's not in the country right now, and we have the time difference of 5 to 6 hours. We are waiting for him to come up. So if after the speech, is not on yet, we have to take Professor Awaluba, our distinguished former Vice Chancellor of Bauchi State University, now has a quick professor. Professor Oluwasegun, the moderator, please take note. If you don't have Baba yet, Baba Yakubu, with Awaluba, we will take it. So, you can please share your material with us, right? Okay. Okay, we found it already. So, I don't know. Now, we are going to start now. Please, can you mute your microphones, everybody? Azad, good luck. Akaya, good luck. Please mute your microphone. We want to
Akaya, good luck from Rivers State. Joining from Rivers State. Yeah.
When time for introduction come, we'll call everyone to their voice. Please. Sanitarian, Sonny, please, can we share the agenda so that we can also know where we are? Then we'll commence officially as the national president has declared.
Sorry.
This is Akaya, good luck. While we wait for the agenda to be shared, I plead to join our lecture here in Rivers State Primary Healthcare Management Board. I will rejoin in a few minutes' time. Permission to rejoin.
It's open.
Program. So what is happening?
Media and your job, please can you tell people to mute the microphone?
All right. I think if we start the event properly, we will have to mute everyone. Otherwise, we may, some people may have difficulties to do it themselves. So please, in the meantime, you can mute your mic, please. Wherever you are, mute your mic. Unless you are asked to speak, please do not speak.
You signify.
If you want to speak, you can raise your hand. But that is not even the time for us to speak. Yeah. All right. Sanitarian Abubakar Hassan, please mute your mic. Okay. Comfort.
Yes, sir.
How are you today?
I'm fine, sir.
Oh yeah, comfort my people. You're welcome, ma.
Thank you. Good morning, sir. Good morning, fellow colleagues.
You're welcome. Good morning. Please, Abubakar, mute your mic.
Okay, sir. Good morning, sir.
You're welcome.
Okay, thank you, sir.
All right.
The agenda is clear. So, can we have opening prayer, please? From opening prayer, please, sir. So, our leader.
Thank you very much. Yes, I did.
Yeah, please, mute your microphone. Thank you.
Mute all microphones. Admin.
Let us take 1 minute to pray in our individual faith, please. 1 minute.
Okay.
1 minute. Ya Allah, as we start this program, may it end up in success. May everything that we will discuss today and beyond be successful, turn out to be useful to our people. May God uplift the practice and everything that is associated with public health and environmental health in Nigeria. Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alamin. Ar-Rahmanir-Rahim. Maliki Yawmiddin. إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين. Amen. Thank you.
Sir, thank you so much. We really appreciate you, sir.
Thank you. President, I have sent you my presentation. Please send to the person controlling this to share when I...
We are trying to... Dr. Baba Yakubu is still not reachable because of the time difference. He's in the US now, in New York. So we might be taking you first, sir.
No problem.
So, Professor Oluwasogo, this is the time for you to take over. And after the speech of the national president, now I take the speech. Good morning, distinguished colleagues, members of Environmental Health and Public Health Practitioners Association of Nigeria. This is a speech for the World Environmental Health Day 2025 by the National President, Dr. Akindele. Theme: Clean Air, Healthy People. Yes, colleagues, members of the Environmental Health and Public Health Association of Nigeria, ladies and gentlemen. Good morning on this World Environmental Health Day under the unambiguous theme, Cleaner Air, Healthy People. We gather not only to celebrate our profession, but to confront an urgent, measurable crisis. The air our people breathe as environmental health and public health practitioners. We are the sentinels at the intersection of environmental and human health. Today, I speak plainly with data about where we are, what it cost us as a nation, and what we must do together to secure cleaner air and healthier life for our Nigerians. Air pollution is still of the problem in Nigeria. Air pollution in Nigeria is an abstract hazard. It's not an abstract hazard. It is a major quantifiable threat to life and productivity. National analysis show that air pollution was the third leading risk responsible for roughly 198,000 premature deaths that year. More deaths that were caused by some familiar infectious diseases. This burden reflects both outdoor ambient and household air pollution, acting together to harm our citizens. In major urban areas, the situation is even starker. For example, in Lagos, Port Harcourt, Abuja, Kano, and many other large cities, our largest cities and economic engine, for example, Lagos State, had an estimated 29,900 premature deaths attributed to air pollution in 2019 alone. These are not nameless statistics. They are mothers, fathers, workers, students, and children lost prematurely because the air around them was toxic. What's the measure? What does this tell us? Particulate matter with a diameter smaller than 2.5 micrometers, PM 2.5, is pollutant most strongly linked to mortality from heart disease, stroke, chronic lung diseases, lung cancer, and acute respiratory infections in children. Nigeria's population weight average particulates pollution has increased over the past 2 decades. Reported increase of about 24% from 1999 to 2021, eroding life expectancy and worsening health across the country. In many Nigerian cities and hotspots, short-term PM routinely exceed levels recommended by Global Health Authority. For the perspectives, the World Health Organization updated their quality guidance places the annual safe level for PM 2.5 at a very low threshold. Compliance with the guidance would protect millions. That the vast majority of Nigerians are exposed to PM 2.5 level well above WHO's guidance, which translates directly into higher risk of cardiovascular and respiratory diseases, adverse pregnancy outcomes, and lost childhood development, health and social impacts. The health consequences: higher rates of ischemic heart disease, stroke, chronic obstructive pulmonary disease, lung cancer, lower respiratory infections in children, increased hospital admissions and missed work and school days. Economically, air pollution imposes large healthcare costs and reduces labor productivity, a double blow to families and to the nation's development trajectory. Globally, fine particulate pollution PM 2.5 is estimated to contribute millions of deaths annually. Nationally, the toll in Nigeria is already tragically high and rising. Main sources of pollution in Nigeria: multiple source feeds Nigeria's polluted air: vehicular emissions, including aging, poorly maintained engines and two-broke motorcycles, inefficient combustion of biomass for cooking in households, open waste burning, diesel generators, both urban and peri-urban areas, industrial emissions, brick kilns and agricultural burnings, rapid urbanization and increasing vehicle fleets without commensurate transport planning only magnify exposures. This sector are where targeted policy, pragmatic action will yield measurable health gains. What do we do then as practitioners? Members of EPAN and ladies and gentlemen, number one action: surveillance and data-driven action. Expand and standardize air quality monitoring, fixed and low-cost extensors, and make data policy available so environmental health practitioners, health services, and citizens can act promptly. High-quality local exposure data allows intervention to be prioritized where health gains are largest. Number two, household energy transition. Scale up access to clean cooking solutions, LPG, electricity where feasible, and improved cook stoves to cut household air pollution, which remain a major contributor to national burden. Subsidizes and supply chain strengthening for clean fuel must be part of public policy. Number three, clean transport and fuel. Enforce vehicular emissions standards. Phase out pre-Euro and highly polluting vehicles. Promote public and non-motorized transport and reduce reliance on diesel generators through improved grid reliability and distributed clean energy solutions. Number 4, control of industrial and waste emissions. Enforce regulations on industrial tax, retrofit polluting facilities, eliminate open waste burning through sound waste management, and formalize small-scale industries where feasible with cleaner technologies. Local government engagement here is essential. Number 5, health system readiness and public education. Integrate air pollution into routine public health messaging, clinical guidance, e.g., for asthma and COPD and cardiovascular disease, and maternal child health services. Train health workers and to recognize and counsel on pollution-related risk. Number 6, cross-sectoral governance and financing. Air quality is not solely an environmental issue. It is a development, transport, energy, health, and urban planning problem. We must mobilize financing, domestic and international, and adopt integrated air quality management at federal, state, local, and all tiers levels of governance. Steps and for practitioners and policy leaders. 1, we must demand routine, transparent air quality data in every city and major towns. 2, we must prioritize clean cooking promotion in all maternal and child healthcare programs and lead distribution to society safety nets and micro credits, local actions, public health outreach, and NGOs. Number 3, advocate for and support state-level air quality management plans with sector targets, transport, industry, waste management, environmental management, household energy. 4, strengthen energy response and clinical preparedness for pollution-related health surges. Build community-level awareness campaign on reducing exposure during high pollution periods. Closing. What do we take in this? The morals, the medical and economic perspectives, which actually necessitates the initiative by International Federation of Environmental Health to commemorate 6 of and participants by EFAN organizing this particular lecture. The perspective, more than a luxury, clean air is a right and an indispensable prerequisite for a productive, healthy nation. When our children breathe clean air, their brains and lungs develop. When our workers breathe clean air, they are healthier and more productive. When the aged individuals breathe clean air, they live longer, healthier life. The data are clear. Our pollution shortens lives. Air pollution shortens lives and undermines our development goals. The evidence is not waiting for another committee. It is speaking to us now. At FPAN, Environmental Health and Public Health Practitioners Association of Nigeria, we pledge to 1, lead evidence-based advocacy for air quality improvement at national and state levels. Support the rollout of monitoring and public reporting. Strengthen clinical and community responses to pollution-related diseases. And partner with government, civil society, and the private sector to implement proven interventions that cut pollution quickly and equitably. Dear colleagues, policymakers, and citizens of the Federal Republic of Nigeria, the task before us is large, but the tools and the knowledge to reduce pollution and protect health are within our reach. Let this World Environmental Health Day 2025 themed cleaner air, healthier people mark a renewed cleaner air for every Nigerian, healthier people of our nation. Thank you very much. Long live Environmental Health and Public Health Practitioners Association of Nigeria. Long live Federal Republic of Nigeria. Thank you.
Our president, thank you, sir. Can we give our president a round of applause? Can we give him a resounding ovation? He's done a wonderful comprehensive, very deep, very apt, very precision, data-driven, evidence-based, and programmatic, pragmatic. I have spoken as an heritage scholar, back up with things, back up with field experience, spoken as a leader with authority. We celebrate you. Still on the existing protocol, I believe this is going to be a time of deliberations, and at the end of these presentations, we'll be coming up with resolutions. We'll be coming up with action points, communicate. You know, I'm a public health expert. I'm Professor Lalubi. I believe in data. Most of the challenges we are confronted with in Nigeria is because we don't have accurate, comprehensive, holistic data that can be geared towards disease control. Knowing fully well that no data, no disease control. When data is incomplete, how will you now convince the institution of decision-making and policy? We as practitioners, we shouldn't join the bandwagon of individuals that are illiterate, that keep blaming the government without coming up with tangible, data-driven solutions that we can use as an evidence to commit our leaders, to commit our senators, to commit our decision makers to actions. So, straight on the concept of today, clean air. Our team runs clean air, healthy people, air quality, and the health burden. We cannot be talking of health burdens without talking about disease burden. Our variables are connected. Our variables could be dependent variables and independent variables. From our knowledge of epidemiology, we are trained to ask questions. Who are the people affected? Where is it occurring? How is air being polluted? Activities, what are the activities that drives air pollution? Our president has laid a very solid, inspiring, intriguing foundation for us to build upon. Without wasting much of our time, I would like to point out some actionable points from that erudite presentation from our president. One, our president emphasized the need, how essential is air to life. When we are talking of life, it goes beyond the environment. The air we breathe in, there is the component of the environment, the physical environment, the chemical environment, directly or indirectly, the ecology, the soil. There is air in the soil. There is air in water. There is air in the food. The air we breathe in
the hair component is essential to our life. Take, for example, what are the components of hair? Hair is made up of oxygen, carbon dioxide, nitrogen, ozone, carbon monoxides. They are all engrossed and cumbered, connected with air. The oxygen we breathe in as the plant, and the failure of the plants to generate, to produce, utilize carbon dioxide will eventually lead to low production of oxygen and glucose. It is the glucose that eventually transforms to the food we eat. We look at, he also emphasized the climate. Now we are in Africa, we are confronted with alternation of both cold and warm climate. That is why you have the vectors. The vectors can thrive, the insect can grow. Unlike the West, that is extremely cold, like Canada, Missouri in the United States, they have snow all around here. That is why you can't find life. You can't. We are blessed in Nigeria. We have alternation of both cold and warm climate that favor vectorial spread and vectorial proliferations. And we have the animals, the residual host. He has explained diverse sources of air. The air could be gotten from the wood. And what are the? He was able to link the air component to air pollution. The air is available in Nigeria by virtue of a lot of factors and forces, anthropogenic activities. Our hair is polluted. What are those anthropogenic activities that pollute our hair? He also has wood, the use of wood, the use of charcoal, generator, cooking gas, and the use of kerosene stove, all regulated. All these activities are unregulated. Bush burning, unregulated. You have animal poaching and smell our road, contaminate our road. On a clean note, he was able to also link that to the health outcome. How is the air we breathe in influences our health? How does it determine our health? For example, the vulnerable individuals, the people that are at most risk. One, children below 5. The children below 5 are individuals with low level of generations through B cells. They are obviously low because the immune cells are still not fully mature. The liver, the spleen, they are still not properly mature for the T and the B cells that are machinery or machines that are expected to generate adequate immunity. So the children are at risk of air pollution. And what are those health challenges associated with air pollution? One, child pneumonia across under 5. The mortality rates keep increasing because of exposure to polluted air. Another health implication, health status, is respiratory illness. A lot of respiratory challenges like inability to breathe, inability to cough, snow, children. All these are outcome air pollution, pneumonia, premature death. A lot of death, and it's still increasing. The morbidity and mortality rate is increasing. Our nation is losing millions. Because I couldn't get a flight that is suitable, and I don't want to miss the program I'm here for. I have to come by road. I spent close to 6 hours between Mokwa.
Prof, can we move on with the first lecture?
There's a road that busted out before you reach Bida, so that you can escape the trailers. Every jam pack of trailers in bidazes. But before I could get to that road, maybe fag out.
Prof. Solanu,
Yeah, and we were on our
hello, Prof.
Put on our AC. So why am I saying this? The increased traffic congestion is a challenge, especially at trailers.
Hello, Prof.
Also,
hello, Prof.
the nation is losing money associated with poor air regulations. In terms of dollars, we are losing money in management of health.
Hello, Prof. Solanu, please.
Related to
Our president.
Hello, Prof. Is that they are looking for attention.
So I can get excessively on costing health.
The attention is needed, sir.
Prof, please, the national president is calling your attention. Prof.